We're gonna get started on the good stuff, which is postmortem changes. What happens to a body after it dies? How fast does it happen? What kind of things can we see? Yeah, sure. Sorry. Yeah, go for it. Whatever you need. All right. So somatic death is death of the body. You lose consciousness, your heart stops beating, you're dead. Cellular death happens at a different rate depending on what cell type you are. So, for example, a brain cell is going to probably die first without oxygen, followed by like a heart cell. The last things to go are going to be like tendons, bones, and connective tissue, has a really high tolerance for low oxygen. So your physical body can be dead for a while, but some of your cells are still kicking for quite a bit after. It is not uncommon with fairly freshly euthanized mammals or not so freshly euthanized lower species like fish and reptiles and amphibians and things, that their muscles stay twitchy and active after death. One of my favorite, most tragically hilarious pathology stories is when I was a resident. We did all the work for the National Aquarium, which is in Baltimore. And they once sent us an adult sand tiger shark, which was pretty cool. And the vets from the aquarium came and they said, you know, while you're doing this necropsy, we would like you to remove the jaw because it's cool as shit and we want to hang it up somewhere in our office. And our head necropsy technician was like, I'm sorry, I can't do that for you. It's too dangerous because these animals, even after they've been dead for a long time, they stay really twitchy. So if you're cutting the muscles around the jaw, you could get bit. It's really not safe. And they were like, we don't really care. We just want the jaw. And he was like, all right, here's a knife. You can do it yourself. So these non-pathologist clinical vets from the zoo, it was the head veterinarian and another veterinarian and then like a technician. We're all there from the aquarium, sorry. And they start cutting into this jaw and the head vet from the aquarium gets bit down to the bone and goes to the emergency room where she has to tell them that she got bit by a dead shark. So she leaves, the second vet takes over, gets bit by the shark. Not as bad, does not have to go to the emergency room. But at that point they decide, hey, maybe this isn't safe and we shouldn't do this. So muscle cells, connective tissue cells stay alive for a long time, especially in lower species where their tissues have higher tolerance for low oxygen. Okay, so we're going to talk about postmortem changes. The importance of these are they are not lesions, but they can confuse you. They can look like lesions if you don't know what you're looking at, and they can hide the presence of true lesions. So as a general principle, the more rotten a body gets, the less my ability to tell true lesion from just rot, right? If you think of the whole process of rot, we start with a freshly euthanized body, muscles still twitchy, and we all go all the way to soup, right? And all of those cases come to me everywhere in there. And even with the soup cases, sometimes I can get a little bit of information out of there, but my ability to tell you anything meaningful is going to be pretty limited the longer the thing has been dead. What you guys can do, you can minimize this with cooling the body rapidly. Please don't freeze it unless there's no way you can get it to me within a couple days. If you think it's going to be like 2 weeks to a month before you can get it to me, freezing is better than not doing a necropsy at all. But freezing causes artifacts in the body that I can read through. It's better than rot, but it's not the best. Here are just some kidneys. Can anybody tell me what species these kidneys are from? Oh. What? Why do we think it's cat? It's small. What else? How do you know it's not a small dog? This is an anatomy question, not a pathology question. What's that? What's this? Why does it seem lobulated? What are these things? They're blood vessels. Cats' kidneys are the only ones that have these cortical blood vessels that radiate off the surface, making them look like bottles. So when you see that, it's cat. Of course, I like to point out the dead kidney, right? Like this is a great example rather than fresh one. I feel like you can see the vessels better, right? Because they're congested, they're filled with blood.
I have a question.
Hit me.
So if we're in practice and we have an animal who may potentially go to necropsy, do we not put them in the freezer?
You often do.
Okay.
I would rather,
Okay.
if you can keep, yeah, it depends on the postmortem interval, so we're trying to do. Well, we're trying to do two things, we're trying to preserve the body and keep it from rotting. But we're also trying to do it as quickly as possible. If we can't do it as fast as possible, freeze it, because it's gonna keep rotting. So if you think it's gonna be like a week, week and a half, 2 weeks, freeze it. If you can get it to be in like 2 or 3 days, just keep it cool. Yeah, always refrigerate, never leave it out in the open. All right, here's why we want to freeze it, because progression of autolysis, which is auto self-lysis, literally the body digesting itself. The progression of this process depends a lot on environmental and host factors. So a body out in the sun in the summer is going to rot way faster than a body in the winter or the spring. A sheep is going to be rotten no matter what, whenever you cut it open. There is no such thing as a fresh dead sheep. It dies, it is instantly rotten inside because the wool keeps it warm. It's hard to cool them internally because they're insulated. If the animal dies with a fever or has a severe infection, especially a bacterial infection, that bacterial action is part of the process of tissue breakdown, so it's going to be accelerated if the animal is infected or has a fever, higher body temperature. This causes a lot of changes in tissue. A lot of what I think we were probably describing in that apple was autolytic change, just the process of rotting. In tissue, it causes a lot of changes in morphology, color, texture. There is definitely a smell that autolysis has. If you have been to the necropsy floor before, ever, you know that smell. It always smells like that in their varying degrees. Bacteria are gonna produce gas, so you can see gas bubbles within tissue. Like sometimes you can see a spleen, and when you palpate it, it feels like a lung because there's so many little air bubbles popping in it. It's disgusting. Wonderful. The animals float, especially like ruminants that are got a fermentation vat inside, and the body just starts to ferment all of it. Sloughing of mucosa. So this is when you come to the necropsy floor and I ask you to look at the mucosal surface of the intestine and you start rubbing the food off of it with your finger. I'm gonna smack your hand with a ruler because you're rubbing all the mucosa off because it's dead, and that's one of the first things to go. Mucosa loses its attachment to the basic membrane. It just this is really challenging. I even still sometimes have trouble knowing the difference between autolysis and a true lesion. When the autolysis is severe and the lesion is subtle, that's when it's most difficult to tell. All right, yeah.
Does that process begin before they're dead? Like,
No.
they're
By definition, no.
okay.
If you're being digested by bacteria while you're alive, you have a severe bacterial infection. You have an itis. The tissue is alive and responding. All of this that we're talking about happens in dead tissue, which by definition is unable to respond to any insult. So one of the classic questions that we get when we get a lot of legal cases through the floor. So, animal was, shot or comes in with a broken skull. One of the big questions is often, did this happen before death or after death? Did this cause death, or did, the dog die on a balcony and fall to the ground, right? Live tissue bleeds. Dead tissue does not bleed. So if an animal comes in with a wound that is clean and not bloody, it happened after it died, right? Because live tissue responds to insult. Dead tissue just rots, it does not respond.
But what if you have an animal with a limb that's necrosed for a while and it's just hasn't fallen off?
The tissue will respond to that. That is not autolysis, that's necrosis, and we're gonna talk about that a lot next week and how necrosis is very different from autolysis because it's an active process. Great questions. guys are ahead of the game, you're already asking me week 2 stuff.
Are we able to tell if the bones were broken before or after death as well?
Yes. Live bones will bleed, you'll have a little bit of fracture callus, talk about that, now you're asking me like week 4 or 5 questions. Let's slow it down. Yeah, you'll get a fracture callus really, really early, you'll get fibrin, blood products coming into the space, hemorrhage, it'll bleed. So live tissue always responds to an insult. Amazing questions, any more? Sick. Let's name them. Not sick, actually, dead. Rigor mortis, everybody should know this one, because this is the one that's on TV. So what you might not know about it is that it's temporary. The body is going to stiffen for a period of time, and then after that period of time passes post-mortem, the body is going to relax again. So rigor mortis is a transient phase. All muscle undergoes rigor, including the heart. The heart can be in rigor. So if you see the heart and it's fully contracted, that might look like cardiac hypertrophy. It might look like the wall is too thick, the heart is too big, just because it's really contracted. The urinary bladder, I get students constantly looking at dead bladders and being like, this wall is so thick and the bladder is so small and weird. What's going on? It's contracted, it's in rigor. GI too. So what's going on here is you guys, you're in phys right now. Do you know physiology of muscle contraction?
Yeah.
If I do this, everybody knows what that means? Little heads, cool. So for the heads to let go after they've contracted, they need ATP, which you can only make if you're alive. So once you're dead, no ATP, this gets locked in and we're in rigor until it breaks down. So it's rigor and then autolysis. Happens with ATP depletion. Probably most important thing for you guys to remember is that it comes and goes. So a dead animal is not always going to be in rigor. There will be a period of time when it's very fresh, when it will not be, and then there will be a period of time when it's less fresh, that it will not be.
Do different organs or different parts of the body come out of rigor at different speeds?
I don't know. Don't worry about it. It doesn't matter. It's not really important, right? The presence or absence of rigor doesn't really tell us a whole lot. It's not informative. It's not really useful. It's just something to recognize.
I'm assuming this plays into some strategy on when you want your necropsy done. It doesn't matter.
I can do an animal on rigor.
Well, I mean, like before versus after rigor.
I want to do a necropsy as soon as possible, regardless of any other factor. That's the only thing.
I'm sure lots of these things are like multifactorial, but it seems like this, like, rigor mortis is primarily like given by ATP depletion, whereas like cell death, somatic death is like hypoxia sort of.
It's a lot of things. That's a week 2 question. Please hold. Often hypoxia. Yeah, that's one of the most common underlying.
Since they do talk about this on TV a lot, I, being someone who watches a lot of murder mysteries, have heard a lot of times how, like, rigor doesn't set in for a little while.
Yep.
So, it's temporary, is there like a normal amount of time before it actually sets in?
There probably are published numbers for that in humans. I doubt. Well, maybe. Veterinary forensics is a thing. We have a 3rd-year pathology resident who's actually doing a master's in veterinary forensics. So search the literature. That's a great question. There may be that research may be out there because people are interested in like time of death and stuff. For me, I just kind of, I note it and move on. I basically ignore it at this point.
You want Dexter?
Yes, until the last.
I.
And then, okay, we need to move on because now I'm getting bad. All right, liver mortis. We're getting into the less common. You may have heard this one on TV, but maybe not. This is also called hypostatic congestion. I like that name a little better because it helps you remember what it means. So hypo is low versus hyper is above or too much or more. So we're low or under. Static is something that's not moving, and congestion is blood pooling vessels. So hypostatic congestion is blood pooling because it's not moving under the body. So this is just the settling of blood on whatever side of the body is down. In humans, that's usually the back because of our shape, kind of long this way. We die on our backs. Animals are long this way. They usually lay on their sides like this guy. So in an animal, livor mortis will usually divide the body like this. So you will have one lung that's very dark with blood and one lung that's light. You'll have one kidney that's very dark and one kidney that's light. This is something we usually see in paired organs and also in skin. Especially pig skin, because it looks so human. So. This is actually the side the pig died on. The side that's up was down and we flipped him over. So all his blood, look how dark his ear is, because his ear is most dependent, right? All his head blood is draining into his ear. So this is just pooling with gravity because your blood's not flowing. This is the classic appearance in a lung. If you see a lung divided like this, half dark, half light, that is hypostatic congestion. Livor mortis is not truly a lesion. It's a postmortem finding. Anybody know what happened here?
I don't grill.
Died on a grill. He's like, I'm ready, take me home. Yeah, a grill or a grate or a fence or something. So he's white or blanched where all the blood has been pushed out, but wherever the fence was pushing. So you can sometimes see this in internal organs where things are pushing against each other. That pressure will cause a little pale area in the point of contact. So liver, kidney do that a lot.
Sorry, you said, what did you call it? You said like, it's not a lesion, but it's.
Postmortem artifacts,
Oh.
postmortem changes. All of the things we're talking about right now are not lesions ever.
The lung picture,
Yep.
one was pink and one was bluish or whatever, sorry, I don't have structures anymore, they're out of my brain. Would you say like left lobe, right lobe, hypostatic congestion, like? would you-
Again, so descriptors are less important for the changes we're talking about today because these are not lesions and we don't care about them except to notice them and exclude them as causes of disease.
Oh, so that you wouldn't say that was in the report?
I might describe it, but at this point, like, so for you guys, for the students that come onto the necropsy floor, I want you to describe this and note it because I want you to notice everything, right? We're playing spot the difference. That is a difference between a normal lung. But I also want you to know it's not an important difference. That makes sense?
Is the congestion the one side though?
Yes, so congestion is blood pooling, congested tissues will be dark red or purple. All right, this one's really fun. You haven't picked up yet, I am into pathology for the words. That's like at least 50-60% of it, and the rest is pus. So imbibition, we all say that together. Imbibition. Imbibe means to drink, but it's like fancy drinking, like peaky up. Like I don't imbibe coffee, I think I would imbibe champagne. So it just means drinking, it's fancy drinking. So this is tissues drinking up pigments that are in the body. Endogenous, endo means inside, so pigments coming from inside you, blood pigments, bile pigments, bacteria produced pigments are the three pigments. So tissues are drinking up these pigments, and that is pigment imbibition. Hemoglobin can be imbibed by tissues. Usually in the vascular system is where we see this, so the aorta is probably the most common. There's a normal aorta, it should be white. You've had prolonged contact with dead blood, those blood cells are breaking down, releasing their hemoglobin, it's gonna stain tissue. So this is hemoglobin imbibition, it is red. Bile imbibition, this is the one you're gonna see more commonly. Here's some normal livers. Here's some livers that are drunk on bile. Bile imbibition happens locally around the gallbladder. Does that make sense? It's really the main place we have bile. So bile imbibition is going to be very focal and it's going to be right around the gallbladder. Here it is on the liver. Here it is on the guts that have been pushed up against the liver. Green staining, bile inhibition.
What did you say? So you said that your guts got pushed up against the gallbladder. Do you not see any like right at that pillow where the bile's coming out in the bladder?
So
Or is it mainly just because the gallbladder is now leaking the bile around it?
so yeah, bile is breaking down, bile is a digestive substance, it's eating the gallbladder and coming out and staining the tissues around it. So the outside of the guts are green. If you cut into the lumen, would not be green inside.
Okay.
Unless this animal like ate right before it died and contracted its gallbladder and squeezed bile into there and it's sitting there, which I don't really see. So usually this is like a surface change. It's on the outside of tissues and it's only around the gallbladder. You will confuse bile inhibition with pseudomelanosis because they're both kind of green. They both do the liver. They look really similar. However, notice this is not near the gallbladder and it's kind of a different green. This is bile green. It's anywhere from like yellowish green to like really dark, almost black green. It's bile colored. This has a blue tint often. It's like green, blue. I don't know what somebody could tell what color this is, like teal, cyan, aqua, forest green. These aren't bile colors white, right? That comes with experience, but these are bile colors. These are slightly different. There's a little more of a blueness to it, I think. Do we have, how many colorblind people do we have in here that feel comfortable disclosing? 10. Okay. I would love to talk to you later. I would like to study you. Because I understand you probably have trouble with some of this and I would like to make that better for you guys as an aside. But there is definitely like a blue-green quality to this that does not look like bile. The biggest thing though is that it's not immediately around or touching the gallbladder. It's usually where things have been touching the guts because it is the result of bacteria eating red blood cells. This is basically bacteria poop after they've been feasting on your blood. Don't give me that look. It's a circle of life, it's fine. Bacteria are people too. So it's usually where we're touching guts because that's where all the bacteria are. So it's on the ventral surface of the liver, again, where the guts have been pushing up. It's often on the kidneys. Here we are on a spleen. Here's another kidney. So like kidney, liver, lower abdomen, not around the gallbladder or the pseudomelanosis sites. You can also see it as the animal starts to get really rotten. You can see it outside on the skin. The belly will become green from the outside. So there's ways of telling how rotten an animal is before we even open it. It can be helpful. All right, postmortem clotting. So after death, your blood clots pretty quickly, but then just like the rigor mortis in the muscle, those clots are eventually going to break down over time. A lot of people tried to get me to use postmortem clots as evidence of anything, and you really can't because they form and then they go away. And it's a variable interval because the rate of autolysis is variable depending on environmental conditions, the state of the body when it died. So I can't tell you anything by the state of a dead animal's blood. If it's clotted or not clotted, doesn't really mean a lot to me. Maybe unless it's super fresh. If an extremely fresh animal's blood is not clotting, I might be like, this is kind of funny. So if you think you have a coagulopathy and you want to submit for necropsy, please collect blood before you send the body. There are some things I can't do. A lot of the things I cannot do with the dead body are going to be functional analyses. So hormone levels, liver and kidney values, I can't tell. So I can tell you that an animal has severe liver disease or severe kidney disease, but I cannot tell you the animal was in liver or kidney failure unless I either see those values or I have other lesions in other organs that tell me they have failure. That makes sense? Yeah.
Does this mean that if you're suspecting something like a embolism, you're not really able to confirm that?
That's a week 3 question.
But clot, basically clotting is not.
So the importance, again, this is a postmortem artifact, postmortem clotting, the way blood acts after it dies. The importance of postmortem clots is that we need to distinguish them from thrombi and emboli, which happen in life and are true lesions. So we need to know what dead clotted blood looks like so that we can tell the difference between this blood clotted in life in a place that it should not have and it caused a problem, or is just dead. That makes sense? So don't worry about these things as things, worry about them as things that are going to distract you from the real things that we're trying to look at. Really, really important. I cannot test dead blood for anything. I can't give you a hematocrit. I can't do a CBC. Just say no to dead blood. It's no good for anything. You need blood, take it before you euthanize the animal, please. There is one thing you can do with dead blood, and that's check it for anthrax spores. You have an animal that's bleeding from orifices, you should not do the necropsy because it might be anthrax. If you have a high suspicion, you're gonna take a little bit of that drippy blood, you're gonna put it on a slide, and you're gonna see the anthrax. That's the only thing I know of that you can do with dead blood. Just say no. Okay, again, the importance of these is we were trying to tell these from clots that happen in life. Ante is before, so ante-mortem, before death. Clotting that happened while the animal was still alive, the body responded, it caused a lesion. Postmortem clots, not lesions. We're settling out with gravity. So if you think about, if anyone's ever left blood in a red top tube or a serum separator, all the red cells to the bottom, all the plasma and the white cells stay on top. That's what this is. We call it a chicken fat clot because the serum and all the plasma proteins, when they clot, they kind of look like chicken fat. So if you see a thing that's half dark red, half yellowish pinkish, as a postmortem clot. Happened after the animal died, we don't need to worry about it. The other thing that these things do is they form a perfect cast of the vessel. So if you look at this, you see all these little tails and branches, that's basically highlighting a vascular tree. It's basically an anatomy specimen. Look, we even got this tiny little vessel branching off right here. So cool. So it makes a perfect cast of the vessel it's sitting in. A thrombus will not do that. If a clot forms in life and sticks to a wall, blood is constantly going past it. It's hanging on for dear life, right? And its morphology is going to suggest that. It's not, this was just sitting there. I could pick this up and break it apart in my hand. I like to squeeze them and they just kind of go, just kind of disintegrate. Great. They're very rubbery and gelatinous. They're really soft. I can break them apart really easily. They make a nice plopping sound when you drop them on the floor. They have a big horse heart or something. They come out really easily. They're not stuck to anything. There's no attachment, so you can just pull them out really easily. If this clot happened in life, that blood is flowing really fast, it's hanging on for dear life, that thing is gonna be stuck tight like a tick. It's gonna be dug in there, you will not be able to easily pull it off, it's gonna be very firm. The most common place to see these is where we have big blood spaces. So we see these a lot in the heart, in the great vessels. These are just some more examples. This one I personally took out of some animal at some point, and I just loved all the little tendrils. It looks like a Body Worlds exhibit, like a nerve diagram or something. Fun fact, I like to make fun of real life clinicians out in the world and the things they send me so that you guys don't make the same mistakes. I make fun of them with love. I have received not one, not two, but 3 blood clots from a heart in bags of formalin from practicing vets that said, please tell me what this is. I found it in the heart. Postmortem. Chicken fat clot separated like this. I found this thing, it looks weird. It's in the heart. Did it kill the animal? What do you think? That's a big no, buddy. Sometimes it looks like this. Sometimes it doesn't separate. So it just looks like blood. Again, this looks really different from a thrombus, which you're gonna see in week 3, I think. Okay, barbiturate. So a lot of the dead animals that come to me have died naturally, but a lot of them are euthanized for barbiturates. Euthanasia solution, especially when it's in really high amounts, forms salts with the stuff in your blood, and then it precipitates out. Salts precipitate out in the tissues. It's going to be only on the surface of things, pretty much, and especially in the chest, it seems like. This is kind of a dose-dependent phenomenon, so you're most likely to see this in smaller animals. The smaller the animal is, and the larger ratio of, like, the bigger the overdose that we use to kill this thing, the more of this you're gonna see. I have maybe once seen this in a horse. It would take so much barbiturate. I see this all the time in little pocket pets, birds, rabbits, gerbils, tiny things. Because we usually go intracardiac, which makes it more likely to see it because we're actually putting it in the cavity and they're tiny. So even a mil for some of these is like a massive, massive overdose.
Is it pretty, organ specific? Like,
Not really, it likes the chest, but here you can also kind of see it in the liver. It also, so in addition to this surface stuff, which has a texture, if you close your eyes and feel it, it's got like a gritty, like someone sprinkled like salt on the surface of stuff. It doesn't go into the tissue, so if I cut into this heart, it would not be in the muscle, it's only on the surface, but it's on the inside surface, so that here it's in the lumen, because that's where the blood is. Another thing it's gonna do is wherever it's been going through vessels, it's gonna cause basically destruction of the tissue that it touches. It's really caustic. So if you look super, super close at this liver, we've cut into it here so you can see all the vessels, and you see how there's like a light brown tan that's only around the vessels. That's euthanasia artifact. They blasted this animal so hard with barbiturate, they actually like burned its tissue around blood vessels. I mean, that's what we want. We wanted this thing to die. We did a good job. Right, a couple other postmortem changes to be aware of. Mucosal sloughing. This is one of the first things to happen. So I am Emperor Cusco on the necropsy floor. Do not touch my mucosa until after you've sampled it, or I will do this. The importance of this, the lesion that mimics this is ulceration. So an ulceration is when we have loss of epithelium and we're at or below the level of the basement membrane and the tissue is bleeding, the tissue is responding. If it's just sloughing, the tissue is dead, won't bleed, won't respond. That's the difference, it'll just kind of peel off. Here in the rumen, all this red is exposed submucosa, exposed basement membrane, and this, I don't know if you can appreciate this, but the ruminal mucosa is literally just like coming off in layers, just from us removing the feed content. So the way to deal with this is just minimize handling of the mucosa before you sample it into formalin. After it's in formalin, it's safe. And after I have a sample of it to look at in formalin, it's safe, and you can do whatever you want with it other than lick it. Touch it, grab it, I don't care.
Does that mean on histology, it's pretty common to see the mucosa like separating?
Gone, often gone. Yeah. So again, at that point, if someone has a question, does this animal have ulcerative intestinal disease? Do you think I can answer that? Really? Y'all, I'm like a wizard. You will learn this. Pathologists are wizards. Remember, we make diagnoses based on uncertain information given by questionable narrators. So what have I been saying? What's the difference between live tissue and dead tissue? Live tissue responds to injury. If I have an ulcer, which is a lesion which happened in life, I will see a response in the tissue under it. That tissue is going to be upset. There's going to be inflammation there. There might be scar tissue there if it's been going on a really long time. So if it happened in life, as long as it didn't happen like in the minutes before the animal died, I'm going to be able to tell. Unless it's so rotten that all that tissue even under the mucosa is gone. But I don't need mucosa to tell you there was an ulcer there. Wizard Harry. Other postmortem changes, so lens opacity. The real change here that we're distinguishing this from is cataract. A cataract will remain once the animal has thawed out or warmed up. Lens opacity is reversible. Let's do the postmortem. Corneal opacity. So the only reason your corneas are clear is because A, you're constantly pumping fluid out of them, and B, you're constantly blinking to windshield wiper all the junk off your eyes. Once you're dead and those two things stop, dirt starts sticking to your corneas and they get cloudy. Fluid comes in because you're no longer actively pumping it out and they get cloudy. Bloating, gas. Here's a picture of, what even is this? This is like mediastinum. I think here's lung up here, the red is lung, the thing with the bubbles in it, not lung, that's emphysema in like connective tissue, so gas bubbles in tissues where there should not be gas. Displacement of organs is especially common in large animals, so people are often surprised to know that when I find a horse, I'm not obsessed with where its guts are post-mortem. If there is a change that happened in life, I will see it. If there is a strangulation, I will see the lesions that are evidence of that. But when an animal has died, been picked up on a forklift, been thrown into a trailer, been pulled up on the hoist, swung around by a chain, flipped over, and then put on my table, those organs could be anywhere. Literally anywhere. It's crazy. So I'm not really worried about where things are after death because they move around. We talked about how tissues die at different rates. Peristalsis in your guts also continues for a little while after you die, so you can get post-mortem or artifactual intussusceptions. You guys know that word yet?
No.
It's where, I need my hands for this, sorry. Where your gut is like this, and you've got a peristaltic wave. One piece of gut swallows the gut head of it, and it like until it goes into itself. It probably makes that sound. I've never actually heard it, but that's fine. It's like, and at that point you are obstructed, and this is an emergency. You will die. What was this again?
What was the word again?
Intussusception. It has a lot of S's. I can't spell it right now.
Yes.
It reminds me of Inception. It's like bowel inception, a bowel within a bowel, intussusception. Cooling of the body, predation. Predation is often confused with like cult activity or alien attacks. Not a joke, because predators go for the soft parts, they go for the eyes and the holes. And sometimes removal of eyes from dead things can look almost surgical. It's really just the eye is gone and everything else around is fine. That's usually birds, like crows or vultures do that. So predation is common, especially in larger things. All right, question about postmortem changes.
Like, maybe we talked about it. Alger mortis was on the last slide.
Alger mortis
That was the word.
is just cooling of the body.
Oh.
Yeah, so a freshly dead body is body temperature, and then it slowly loses temperature. That's one of the things they use in humans for time of death. We don't really do that in animals. Probably because they're different sizes and they cool in such, right? It's like a sheep will never be cool inside.
I have a question about the spleen and horses. I
Yeah.
feel like maybe in gross anatomy or maybe other resources before have told us like the spleen on the body that we're working on has been enlarged.
Yes.
Out of barbiturate. But you're saying, well, it probably actually isn't the barbiturate have worse.
No, that's not what I'm saying.
Oh, yeah, you were saying it would take a lot in the horse.
For barbiturate to precipitate out of your blood and form these little crystals,
Okay,
it takes a high overdose. I have never seen that in a horse.
okay.
I see other barbiturate changes. Congestion, massive congestion of the spleen is one of the other most common euthanasia artifacts that I do. What I did last year, because it technically happens in life, it happens like as they're dying. We call that a perimortem change. Peri means around, so it's not before or after death, it's happening around or at the time of death.
So would you see more of a barbiturate artifact in an intravenous euthanasia or in an intraperitoneal?
If you do intraperitoneal, you're gonna see precipitate in the abdomen. Okay, more than in the chest.
Okay.
Great question.
I forgot how to say it, the
Intussusception, mouth and mouth.
yes, that can happen after death?
Yeah.
Well, okay,
Do you think I can tell the difference between a postmortem and a real?
yes.
Yes. That's, yeah, you're how can I tell? Since I'm with her and because live tissue responds. If it gets stuck post-mortem, we're not cutting off blood flow to anything, we're not obstructing the flow of food. Nobody cares, so it's not gonna swell, and I can pull it apart easily with my fingers, I can just go, intussusception gone, and you can't even tell it's there. If this happened in life, as soon as that gets stuck, you guys can practice this with your hands. cut off blood supply to your hand for like 30 seconds and see what happens to it. It turns to 12. It'll get red, then it'll get purple, then it'll get really swollen. At that point, you should stop if you haven't stopped already. Or I should stop. Yeah, see, my hand has changed colors. It's already swollen and a little more pink than my arm. White, a little white. So in a real intussusception, that's what's happening. The part that's stuck is gonna swell up so much that you cannot pull them apart anymore. They are stuck like that. Postmortem, just, oh, you know, gosh, thanks. That's Luigi, his friends call him Penis. He's my best friend.